Shoulder pain can be debilitating and may result from a variety of conditions. If anyone is experiencing shoulder pain, they should seek medical expertise. Dr. Anthony Frisella is a board-certified orthopedic surgeon who grew up and now practices in St. Charles County. He is on staff at both Barnes Jewish St. Peter's Hospital and Progress West Healthcare Center. Dr. Frisella is an expert in the problems of the shoulder and elbow, especially rotator cuff tears, arthritis, and sports injuries.
Most shoulder problems are the result of minor inflammation, can keep you up at night, makes it difficult to reach behind your back or reach above your head. Most of those problems will resolve by themselves over the course of a week or 2 or 3. If a patient is continuing to have pain beyond 3 or 4 weeks, I would encourage them to seek medical advice.
After graduating from Harvard University, Dr. Frisella attended medical school at Washington University in St. Louis. He finished his residency at the University of Iowa in 2006, and then completed an additional year of fellowship training.
Surgeons who are fellowship trained often learn specific advanced procedures in that specific field. In my case, I learned advanced procedures in arthroscopic treatment of various shoulder and elbow problems.
Dr. Frisella's specialized training and expertise allow him to deliver modern, high-quality care to his patients.
Most problems that result in shoulder pain are just the result of wear and tear over time and aren't necessarily the result of a specific injury. Some common reasons to develop shoulder pain are repetitive use of the arm overhead, people who throw a lot, pitch. Golfing is a common cause of shoulder pain. You can certainly dislocate your shoulder, which creates tears and problems with recurrence of dislocation. But in terms of problems that cause pain, in the majority of cases, it's a degenerative wear and tear over time kind of problem.
I had arthroscopic surgery through the shoulder, 3 different places, repairing with the rotator cuff. They removed a bunch of bone chips, some floating bone that was in there. The strength is back. It feels wonderful, and I really couldn't be more happy with the way the procedure turned out.
Another type of patient that I might see is a patient that has had multiple shoulder dislocations. That's usually a younger patient in their teens or 20s who's had a sports-related injury to their shoulder where their shoulder is dislocated and then it's dislocated again and again. So those patients are candidates for surgery fairly quickly if they've had multiple dislocations.
Every time I tried to tackle somebody, it would just pop it out of place. I got the surgery, and then after that I had to go through physical therapy, and it just healed it right up, and now I'm ready to play some football.
I'm a professional mixed martial artist. There's wrestling involved, kickboxing, jiu-jitsu, things like that. I heard it training for a fight actually, and through the MRI we noticed that I had a torn biceps tendon and 2 tears in the labrum. Decided that our best option was to go ahead and do surgery and just take care of it and get me back strong as I could be.
The goal is to have someone who can use their shoulder and use it in a way that they're comfortable with and it isn't too painful. If those things don't work, and this usually occurs over the course of months or years, then shoulder replacement surgery is an option.
This is usually done on a 60 or 70-year-old person, and I'm in my 50s. I've never had a surgery that actually just went exactly like he told me it was going to be. I can pick my grandbabies up. That's my main thing right there. If I can do that, everything else is great.
Another common condition that I treat is frozen shoulder, which also is called adhesive capsulitis. Oftentimes that problem will resolve with time, but if a patient gets to the point where they really need something done for their shoulder, then surgery can be an option for those patients as well.
I'm a housekeeper, so I'm using both arms quite a bit and need the strength. I could only move my arm maybe about to here when I came in, and now I can move it up higher. With some more therapy, I'll be good as new.
Dr. Frisella is very active in teaching and research about problems of the shoulder. In 2010, he published a textbook chapter on sports shoulder injuries. That same year, he traveled to Haiti to provide humanitarian aid to victims of the 7.0 magnitude earthquake that struck Port-au-Prince Haiti's capital.
We treated patients who had been injured in the earthquake, kids and adults. One example of a patient I treated in Haiti was a 6-year-old boy who had an infection in his leg, and he came in to see us with a very huge swollen thigh. We were able to take him to the operating room and clean that infection out, and he did very well. About 3 days after we did the surgery, we were walking in the town where we were, and I actually saw him and his mother, and it was really gratifying because he came up to me and gave me a hug. I was there for about 10 days, and it was a really great experience, actually.
To learn more about various shoulder conditions and treatment options, visit bjsph.org or progresswest.org.